Good afternoon and welcome to today's Q&A session. I will also be recording today's session to be posted on the YouTube channel. My name is Michelle Otley. I'm your HR Benefits Manager. Today we have Elizabeth Martinez, your Benefits Coordinator, and Kyle Sanders from Kaiser Permanente. Please place your phone on mute for the entire call. You will be able to type in your questions at the end of the presentation. Let's get started. Open enrollment ends on Sunday, November 20th. Let's review the highlights. We are keeping the Care First Medical High Deductible Health Plan. The new name for 2017, if you've already enrolled or logged into the system, is Smart Selection. So the current point of service high deductible health plan is now the Smart Selection High Deductible Health Plan. We have made some enhancements to the Care First plan, and we also have the same rates. So there will be no rate changes in 2017 for the medical plan. We are replacing the Care First HMO with Kaiser. So we're welcoming Kaiser to the Unity family. You'll have the same rates for Kaiser as you currently have for the HMO. And we've also removed the medical and prescription deductibles from the HMO plan. Kaiser HMO, again, the same rates. Zero deductible for medical and prescription. You will now have a copay of $30 for your primary, $40 for your specialist, and $10, $30, $50 for your prescriptions if filled at a Kaiser facility. If you do move to Kaiser, you will need to select a PCP and a facility. If you do not select a PCP or facility within 30 days, Kaiser will auto-assign one to you and your dependents enrolled in the plan, and you will still have the opportunity to either keep or change that PCP or facility at your leisure. Care First Smart Selection High Deductible Health Plan, again, same rates. We are removing the out-of-network option on the high deductible health plan. What does that mean and why? The reason why we removed the out-of-network option is that only 1% of our members, which is about 4.5 people, were utilizing the high deductible health plan. We're utilizing the out-of-network option. However, we were paying an additional cost on our premium to have this option. This translated that 99.96% of you were using in-network options. So that we could keep the rates lower and not have to increase them for 2017, we took this option away. We also enhanced the plan by removing the coinsurance. So under the current 2016 high deductible health plan, you have coinsurance after you hit your $1,500 single deductible or $3,000 plus one or more deductible. Moving into 2017, there will be no coinsurance. You will have co-pays once you hit those deductibles of $10 for a primary, $20 for a specialist, and $15, $35, $60 for prescriptions. Your out-of-pocket maximums have slightly changed. So for a single, it's $3,000, and for a plus one or more, it's $6,550. Remember, the out-of-pocket maximum includes the deductible. And once you hit your out-of-pocket maximum, which most of you will never do, the insurance company pays any covered medical prescription, lab, or radiology cost at 100% for the remainder of the calendar year. The deductible resets every January 1. Unity's base contribution of $275 for a single and $650 will be made on January 31st, 2017 to all those enrolled in the high deductible health plan. Your second contribution, which is scheduled for July 31st, will only be made if you complete the preferred rate steps. Additionally, you will only be eligible to earn wellness credits if you complete the preferred rate steps. The great thing is that the preferred rate steps are the exact same steps for the Care First Blue Rewards program. So you have double advantages by completing the preferred rate steps. You keep the lower rates and you are eligible to earn additional dollars through the Blue Rewards program sponsored directly by Care First. Both Kaiser and Care First have emergency services covered worldwide as an in-network benefit for both HDHP and HMO enrollees. And you'll have access to telemedicine and televideo services with both plans. Kaiser provides this telemedicine service at $0 copay to you, and the high deductible health plan has a maximum of $60 if you have not hit your deductible. If you've hit your deductible, you would only pay a $10 copay. Moving on to dental. We are keeping Guardian for 2017. However, we've made some enhancements to the plan. The new base plan will now have a $1,000 maximum plus adult and child ortho, which is up to $1,500 per member, and that's a lifetime benefit. Under the buy-up plan, you have a higher benefit maximum of $2,000, but it does not include orthodontia. For vision, we're replacing Davis Vision with one of the largest vision plan vendors in the nation, and that's VSP. You will continue to have the same great benefits that you currently have. You'll just have access to a larger network of optometrists and ophthalmologists. And lastly, for wellness, we have made changes to the preferred rate criteria for the high deductible health plan and the HMO. So Kaiser will have its own preferred rate steps. In order to remain in the preferred medical rates, you must complete the steps within 90 days after the beginning of the year, so by March 31 of 2017. We will offer preferred rate assistance through one-on-one virtual appointments for anyone that has questions or need assistance in completing the preferred rate before the deadline. And we will continue with our results-based wellness platform, and we will pay higher wellness credits for those outcome-based challenges. Let's do a side-by-side comparison of the health plans. So under the Kaiser HMO, there is no deductible. You have a medical copay of $30 for a primary, $40 for a specialist. Your prescriptions are $10, $30, or $50 if filled at a Kaiser pharmacy. You do have the option of filling your prescriptions at a retail pharmacy such as CVS or Rite Aid or your local supermarket, but the copays are slightly higher should you choose to do that. For urgent care, which Kaiser does offer, there is a $40 copay. Emergency room is $100 per occurrence, and it is waived if you are admitted. For inpatient hospital, it's a $100 copay per occurrence. And for outpatient surgical, a $40 copay for each occurrence. Moving over to the high deductible health plan, you have a deductible of $1,500 for a single and $3,000 for a plus one or more. Remember that the deductible is the amount that you are responsible for paying before the insurance company begins to pay any portion of your claim. Having a deductible does not mean that you are not insured. You are absolutely insured. You are covered at 100% for preventive, for emergency. It's just that there's an amount that you must pay before Care First will begin to pay any portion of the claim. However, if and after you meet your deductible, you will have a $10 copay for a primary, a $20 for a specialist, and your prescriptions will be $15, $35, and $60. Before you hit the deductible, your prescriptions will be the negotiated cost of the prescription. The out-of-pocket maximum, as we discussed on the prior slide, is $3,000 for a single, $6,550 for a plus one or more. Most of you would not be able to obtain that. To get to a $3,000 single out-of-pocket at a $10 copay, you would have to do 350 PCP or 175 specialist visits. Emergency room is $20 per occurrence. It is waived if you are admitted. It's $300 per occurrence. That is a correction. It's $300 per occurrence. It's waived if you're admitted. And a hospital inpatient is $300 per occurrence up to 5 days. If you look on the bottom, you will see the 2017 medical plan biweekly costs. These are the exact same costs that we are paying right now in 2016. I want everyone to pay attention to the first and third columns. Those are the preferred rates for the HMO, which is through Kaiser, and for the Smart Selection plan, which is through Care First. As long as you complete the preferred rate steps in the first 90 days of the year, again, which is March 31, 2017, you will remain in the preferred rate. However, if you do not complete those steps on time, and that means all of the steps, then your rate will increase to columns 2 and 4 the first pay period in May. The medical plan preferred rates and steps. Care First Smart Selection preferred rate steps are again exactly the same as the Blue Reward steps. You must sign in to Care First and either register or log in. You must read and HIPAA consent to Unity Healthcare receiving confirmation of which preferred rate steps you completed. If you do not HIPAA consent, you will not be eligible for the preferred rate. You are protected by HIPAA by Care First, so they cannot give us any results. The only thing that they can confirm is whether or not you completed the step, which is a yes or no. You must select a PCMH or a PCMH plus primary care physician. You must accept e-communication or e-consent. Complete the online health assessment, which is about a 50-question questionnaire asking you about your health and your wellness and mental health and other issues. And then you have to have the PCMH or the PCMH plus PCP that you selected complete the health and wellness evaluation form. If you've already had a physical and 12 months has not expired, your PCP can use that data if it's in the last 12 months. But please be aware that through the Care First plan, you're eligible to receive a physical every calendar year. So on January 1, everyone enrolled in Care First is eligible for a physical, regardless as to when they had a physical in 2016. We ask that you send a screenshot of your Blue Rewards tab to us so that we have confirmation that you completed it in the event that there are any discrepancies on the report that Care First sends to us. Again, if the criteria are not met within the 90-day period, your premium will be converted to the standard rate, which are columns 2 and 4 below the first pay period in May. We will send out the Kaiser HMO preferred rate steps once we've confirmed those with Kaiser. For those enrolled in the high deductible health plan, you will also have a health savings or health reimbursement account. You will automatically be enrolled in this account and you will automatically receive a debit card from Care First. If you have an HSA, both you and Unity may make contributions to this account tax-free. This is not a use-or-lose account. These monies roll over forever. There is a $3,400 maximum for individuals and a $6,750 maximum for families. However, Unity employees who are covered as a single may contribute $2,250, and those as a plus one or more may be eligible for $4,250. And the reason why those amounts are lower is because the annual contribution maximums include employer and employee contributions. If you are age 55 or older, you have a $1,000 catch-up provision, so you may contribute $3,250 or $5,250, depending on if you're a single or a plus one or more. Contributions above the annual limit may be subject to income tax and tax penalty. If you are enrolled in a non-HDHD plan with a spouse, through Medicare, TRICARE, or you've received veterans benefits within the past 3 months, or claimed as a dependent on another person's tax return, you are not eligible for the HSA. You are eligible for the HRA, which is the health reimbursement account. We will automatically make that decision based on your answer from your ADP enrollment when it asks if you have Medicare, TRICARE, or veterans benefits. We ask that question so that we can accurately enroll you in the correct plan. Moving on to dental, we talked about the dental base and the dental buy-up plan. Other than having a $1,000 per member benefit on the dental base plan and child and adult orthodontia up to $1,500, the dental base plan pays 100% for preventive, 80% for basic, and 50% for major. Your 80 and 50% for basic and major will be paid after you've paid your $50 or $150 deductible, depending on if you're a single or a plus one. Under the buy-up plan, again, your preventive is covered at 100%, no deductible. Your basic is covered at 90%, your major at 60%, and again, that's post your $50 or $150 deductible. Again, there is no orthodontia benefit in the buy-up plan, and you have a calendar maximum of $2,000 per member for the 2017 plan year. The employee only plus one or two or more rates are below for both the dental base and the dental buy-up plan. Vision, as we said, we're keeping the same great benefits. We're just moving to VSP. 100% of the premium will be paid by Unity if enrolled in the HMO or the HDHP plan. So if you and or your dependents are enrolled in the medical plan, then Unity will cover your vision premium at 100%. You can also buy up additional vision for dependents that are not enrolled in the medical plan. VSP has one of the largest network of participating optometrists and ophthalmologists in the DC, Maryland, Virginia area. Your eye exams, everyone enrolled can have an exam every 12 months with a $10 copay. Eyeglasses or contact lenses. So you may receive eyeglass lenses or you can get contact lenses every 12 months, and those have a $25 copay. Should you choose eyeglasses, you have a $130 frame allowance and then a 20% discount off of any balance. All about Kaiser. We have Kyle on the line. Kyle is going to give you a very brief presentation about Kaiser and all of the benefits that they have to offer. I'm going to unmute Kyle so that he can speak to you. Okay, it seems that Kyle had some technical difficulties and he was not able to stay on the line. So I'll walk through Kaiser with you. If you look at this page, this is a map of all of the Kaiser facilities. They have some new facilities opening in 2017. One is the North Arundel Medical Center and one is the Medical Center in Hartford County. They also have 24/7 urgent care, lab, pharmacy, and radiology locations. One is definitely the Kaiser Permanente Capitol Hill Medical Center. There's one in Largo, and there's also one in Tysons. Kaiser also has different ways to help you thrive. Their doctors provide personal health advocacy to their members. One of our employees had asked about being able to get an appointment as a new patient. And Kaiser, per Kyle, said that they're committed to getting their new patients appointments within 24 to 48 hours. So there should be no problems with getting that first initial appointment. Additionally, as we have carefirst.com, we also have kp.org. And through kp.org, you can email your provider, you can make doctor's appointments. Once you've scheduled your visit and you have prescriptions, you can have refills done online. Any type of referrals, you can get those online. So Kaiser has really advanced their technology and their EMR to be able to communicate not just to their patients, but between doctors to make sure that they provide total care for their members. Kaiser also has some top docs that have been rated in the 2016 Washingtonian magazine, the 2015 Baltimore magazine, and there was also a 2016 Northern Virginia, but I ran out of space. But as you see, they have about 105 total. This is just a snapshot of providers from all different specialties from the 2016 Washingtonian, and there are 33 from the 2015 Baltimore Magazine. So Kaiser really does have some really great doctors that can provide great care for their members. One of the things that Kyle did share with me is that their doctors have 5 years to become board certified. If they are not certified within 5 years, they cannot continue working as a Kaiser doc. So that should be another reassurance for those that may be considering Kaiser as the vendor of their health insurance vendor of choice for 2017. Let's move over to the flexible spending plans. The 2017 Health FSA plan limit remains at $1,200. For those that enroll in Kaiser HMO or they waive medical, they will be eligible to enroll in the medical FSA. This covers eligible medical, dental, and vision expenses. For those enrolled in the high deductible health plan with either an HSA or an HRA, they will be eligible for the limited purpose FSA, which covers dental and vision expenses only. If you currently have a FSA and any unused funds, any funds $500 and under will roll over to 2017. However, any funds in excess of $500 as of December 31st, 2016, 12 a.m. midnight will be forfeited. We will send you a friendly reminder to spend those funds down, but we just wanted to give you that information as a heads up now. If you do not re-enroll in a healthcare FSA in 2017, any unused funds will still roll over to 2017, but you will not have a 2017 account. So you will still have an opportunity to spend down any funds over $500, but if you want a 2017 FSA, you must log in. If you just look down a little bit and re-enroll in your FSA medical, limited purpose, and dependent care every year. Again, FSAs are tax-free contributions that are made on your behalf for either eligible medical, dental, and vision or dental and vision only expenses. The FSA is pre-funded by Unity, so those funds are available to you on January 1 through a debit card. Unity will then divide whatever your annual selection is over 26 pay periods, and we will deduct that from your paycheck pre-tax. So if this is something that you're interested in, make sure you complete your enrollment online before or by November 20th. Just a reminder, you must log in and make changes or the following will occur. If you are enrolled in a medical plan, whether it's the HMO or the HDHP, you will be automatically enrolled in the Care First Smart Selection High Deductible Health Plan for 2017. If you are enrolled in a dental plan, whether base or buy-up, you will be automatically enrolled in that same base or buy-up for 2017. But remember, the base and buy-up plans are not the same in 2017 as they are now. You must log in and re-enroll in the FSA Health, Medical, Limited Purpose, and Dependent Care plans every year. If you are enrolling in Kaiser or you're in a spouse's non-high deductible health plan, make sure it's the FSA Medical. If you have the high deductible health plan, whether it's the HRA or the HRA or HSA, make sure you enroll in the FSA Limited Purpose. All benefit eligible employees, regardless, are encouraged to log onto the system to verify your demographic data and to update your elections and just check the rates for the 2017 plan year. What's next? We want you to log into ADP, review all the benefit enrollment materials carefully. You have the YouTube channel, you have the emails that we've sent out with all of the materials. Make sure you go through them so that you're selecting the perfect plan or the closest to perfect plan for you and your family. Make sure you update any pertinent information with your emergency contacts and beneficiaries. Re-enroll in your health FSA medical or limited purpose. And remember, all phase 2 enrollment changes must be completed online by 11:59 p.m. on November 20th. If you need more assistance, we're still here for you. We're hanging on, trying to make sure we get you through open enrollment. I would say you could schedule a phone appointment, but you have booked us up for the rest of the year. So if you still have questions or you need assistance, please email us at oe@unityhealthcare.org. We have another webinar scheduled for 3 p.m. this afternoon. And then we have another webinar, which is our last one, on Friday at 12 p.m. and 3 p.m. And our Care First rep, Jennifer Fowler, will be available on that call to answer any questions you may have. We've completed the Maritime Plaza on-site meeting. On tomorrow, DLC will have a full day of virtual meetings starting at 7:30 a.m. to 4 p.m. If you are from DLC, please sign up for an appointment with Michael Gibson so that you can have your session and we can give you the assistance that you need. The Benefits YouTube channel is still here. You can watch how-to Phase 1 and Phase 2 instructional videos. All you need is a computer or a smartphone or a tablet with internet access. And here's the link is below. And again, please feel free to email us with any of your questions. We will either respond to you by email within 24, maximum 48 hours, or we will give you a call. So if you would like for us to call you, please be sure to put a good contact number in there where we can reach you. Again, thank you to everyone who attended today's presentation. I'm going to stop my recording for the YouTube channel, but I'm going to open it up to your questions.